Hello, my name is Dr Claire Gillvray. I am going to walk you through the technique for giving yourself your injection with Mounjaro. Mounjaro will be delivered to your house. It tends to be delivered the next day or 2 days depending on how remote you are, and I tend to, when I'm ordering the first pen, also organise for you to receive a sharps box unless you already have one for any other reason. It is good practice to get into having an area that's near your front door that's marked for deliveries, as we know that sometimes the delivery company will take the delivery away if it's not obvious where it should be left. It's also worth just having a moment and thinking about when you're going to do your first injection. Obviously people get it and they are keen to start, but I would tend to recommend people to think about taking it in the evening or at night time in order to prevent nausea, which can be worst in those first few injections. So thinking about an evening when you're not running around and trying to do lots of things, probably also not leading into a day when you've got something really important to do at work. You're remembering you're going to take this once a week, and my top 3 tips for avoiding that nausea, which is the most common side effect, are to take it at night time and to make sure you're drinking plenty of water, and also to avoid meal skipping. So my priority in terms of nutrition for you is to be thinking about having enough protein and to be really thinking about having that in every meal. When you're going to be giving the first injection, the lid comes off like a pen. The top of it is like a screw top, and you will be given 5 needles with each pen. There are only 4 doses in each needle, in each pen, sorry, so there is 1 additional needle that's just given in case there's any issues with any of the needles. They are very small and they can break, so if your needle breaks, you've got a spare one, but there are only 4 doses in your pen. The needle will screw onto the top of this, and there are 2 caps to come off your needle, one which is a really obvious big plastic cap and one which is quite a small tiny sheath. It's easy to forget that sheath. I've had a number of patients forget to take them off, so do think 2 tops are going to come off this needle each time you're doing it. The real pens are clear in this area where you can see the medication. You can see that being disappearing with each dose. There will always be a little bit extra left at the end of your 4 doses that is just there as part of the product. You can't access it in any way, but don't be confused, there will always be a little bit left in the pen at the end. What Lily want you to do each time you give an injection is to prime the system. You'll see in the window there's a 0. If we take that notch, and it'll only do it one direction, and do 1, 2 to that bigger line, they want you to turn it vertically, give it a hit, and then press that bottom button in. You'll see how that will go back to a 0 in the window, and you might also get a little bit of the fluid coming out of your needle. It's now ready to be given. You're then going to take the pen and you're going to twizzle it all the way, and it's surprising how far it will go, all the way until it will stop, and you'll find that there's a 1 in that window. So it doesn't go any further, and you've got the 1, which is ready to give. In terms of location to give the injection, we're going to give it into our tummy or into our thigh. Lily also say we can give it at the back of the arm, but it's quite tricky to do that if you're giving it to yourself. So I tend to recommend people give it to their tummy in a circle area around your belly button. Tummy, we can kind of grab some flesh and just go in horizontally into your thigh. You can be sitting down and just go directly down into your thigh. They do recommend rotating, and again I would tend to say that is true of any injection, just in case there's a little bit of bruising, and some people have got bruising with this, minimal, but there can be some. So you're going to choose your location. Maybe it's your tummy the first time. You're going to put the injection in and then press that button down at the top all the way down to the bottom. Count to 5, because if you bring it out too soon you'll find that some of the liquid will come out onto the top of your skin. So count to 5, 1, 2, 3, 4, 5, and then come out. If you take your finger off the button at the end, it'll come back a little bit, but not a lot. Screw off your needle, pop it into your sharps container, lid on, and then back in your fridge. These can be kept out of the fridge for up to 23 days at room temperature, but it's good practice to get into keeping it in the fridge just because we have more control over the temperature there.